Hey, how are y'all?
Can you hear us?
Yes, I can.
We can hear her.
You can't hear me? Okay.
Now we can.
I gotta remember to talk into this one. Okay. Move over. Okay, there we go.
Oh, that is over here. Oh, I'll take care of it and put it in the file.
There we go.
Woohoo. And you're just gonna see that stack of papers right there. How's it going?
Good.
Good. Thank you so much for doing this. I really appreciate it. I know we talked about this, I guess, over a month ago, so I'm glad y'all are able to join. And we've been doing this series of webinars. We've had a really great turnout, a really good engagement rates for them. So this will actually be the last one of our series for the time being, unless we decide to do one in the fall or something, depending on how things go. And so I'll start it at exactly 11. We have 2 people in the waiting room now. We'll start at 11. I'm going to put it on Facebook Live and also record it. And then after I record it, I will put it on our website. So that takes a couple hours, and then I'll send you all the links so you'll have it if you want to share it with anyone or if you need it for anything.
I was trying to see. Okay. This is disabled for this. Well done. Hey, Sam,
Yes.
are you able to allow me to share my screen?
Yeah. I'll set that up right now.
There you go.
Okay.
Let me see here. There we go.
You got it? Okay. So before you show this, I am going to show something for CME. I have to put up this CME slide.
Okay.
So I'll have this up just at the very beginning, and then I'll take it down and we'll introduce you all, and then you'll be able to put it up.
Okay.
Okay.
So I'll just hold off on putting it up right now then.
Yeah, but it looks good.
Okay.
Yeah, I've got to show the CME slide
Okay.
because it's available for CME credit.
That works.
There you go. Very good.
Let's see. Are y'all doing anything fun for the 4th?
I'll probably work it. No. No. It's gonna be hot. Oh no.
I know. It's always so hot here every year. That's the only bummer about the 4th of July. And this year, of course, everything's different, but
Yeah.
okay. Hey, Crystal.
Hey, everybody.
Hi.
Hey, Karen.
How you doing?
How are you doing?
Good.
It's good to see you.
Yeah. You too. You
Hello, Dr. Laughlin. How are you?
How you doing?
Good to see you.
You're good. We have no tough technical problems today. Y'all are the first. The first of our hosts to ever just come on and just have it all ready to go and no problems.
Yeah, well, about 20
Don't
minutes.
jinx it, Sam. It hasn't started yet.
I know.
About 20 minutes ago, Rob was having trouble with his computer, so
All right.
it's fixed. I'm gonna let you take off of it, and we're just gonna go back and forth as you need, but why don't you take the lead on it? Because you sound authoritarian. We'll put it in as we need.
Y'all doing okay over there?
We're making it.
We're good.
Are students back on the campus, or are they still e-learning, doing it remotely?
They'll be back on Monday. The fourth years will be back on Monday.
Right. They have
Okay.
in and out of clinics, though. We've had them in separated in clinic.
Wow.
They have been here. We'll shoo them out for 4th of July.
And tell them to not do any large gatherings.
Yeah, yeah, no kidding. Wear a mask, large gathering, wash your hands.
No.
That's 3 tests. That could be challenging.
Yeah. We have trouble getting some of our faculty to do it, much less some of the students. Woo. Yeah, I think they have that. We had the USDDS and I think I just cut and pasted it. You went to Pittsburgh, huh?
Yeah.
DMD.
No, dumb MD.
Well, I'm excited for y'all's presentation. I've been looking forward to this since I read that article in the, was it the Advocate or the Times-Picayune somewhere?
Yeah, that was way back in the beginning.
Yeah, it
A lot of
was.
differences since then. A lot of changes.
Yeah, that's for sure. That's for sure.
We had a lot of people sign up for this one today.
Yeah, we did. Very popular.
Yeah.
They want to see Dr. Laughlin, see if he's real.
No.
Mm. There you go. That'll work. Well, except for if we want to scratch out the staff part.
It works.
It'll work. A slim stamp. There you go. Michelle. Sorry, we're answering emails and stuff as we're going.
Oh,
Signing
go
papers.
right ahead.
He's signing papers and stuff, so. He's found out he has to sign a lot of papers. Oh, and talked to Blakely Bond about doing that research for you, so I'm gonna bring her over to meet you. And then who are you gonna do? Is Peter gonna run it, or?
Yeah.
Okay. I'll hook her up with Peter then, too, also.
I can barely run myself.
Okay. There's too many things going on.
We should have hooked it up in there and sat on the couch.
Yeah, you could have done that. Opposite ends.
Like, hey.
Hey, hey there, we're at the couch. That big portrait the residents gave you up behind us.
Oh, yeah.
There you go, with the commander. Mm-hmm.
Crystal, did you get the script? I emailed
I
it.
sure did. Yep.
Okay. All right, good.
I did.
Script.
We just have to have a little guidelines so we remember to say everything. And so we have your names right and your titles right. And
And we have to mention about the continuing ed and.
yes, that one's a big one.
Yep. What's been interesting is how many people go to the website and download and view these things like later. Like some of them have been downloaded over 700 times.
Yeah, people watch them later.
Yeah. We've been thinking about, once hopefully coronavirus is sort of under control and it's not controlling our lives anymore, that we would continue to do a webinar or podcast or some kind of outreach, because clearly I think we've got a lot of people who are interested in hearing about what LSU is doing. And I'm biased, and I clearly think that on a regular basis we are, we are working every day fighting various diseases and other health crises. And so Sam and I have been brainstorming about, what we would do once coronavirus has died down, to continue to put, our experts out front and center to our donors and friends of LSU. Because it's been way more successful than I thought it was going to be when we first started it. So,
Yeah.
That's good.
yeah. So we'll share that with all of the schools once we kind of have a rough kind of plan or idea, kind of more formalized, and get everyone's input. But it's an easy way to put our experts out front and center. And this morning you shared that some of the news people are sort of sharing and tweeting and liking these things too.
Yeah, Liz Reyes from Fox 8, she uses a different LSU health expert almost every day for her news stories. I think she exclusively is using people from LSU.
Yeah.
That is good.
Yeah.
Yes,
right.
I can actually send her the link to this when it's over. I'm gonna make a note to do that.
That's good.
We don't like the Ochsner and Tulane doctors.
Well,
We don't share anything about those people.
No.
But we know they're not as good, so.
The dark side.
The dark side.
They look good, so they were just trying it out to make sure they could share it.
We got 9 people in the waiting room. And so they'll, everyone who's attending, they'll type in their questions in the chat and I'll read them to y'all so that you don't have to worry about reading them, and I'll monitor that for you. Just a couple more minutes and we'll get started.
That's fine.
Well, they got 15 people in the hole.
Whole thing.
Yeah. 15. They're 16.
So you can click on it and see.
Oh, yeah, I can.
Click and see.
Dr. Block, we should remove him.
Who was that?
Dr. Block.
Oh, Dr. Black, yeah, Black, yeah. No.
Do y'all work with him?
Yes.
Okay.
I'm just going to go ahead and just remove him.
You do whatever you want, Dr.
Give
Laughlin.
him a hard time.
You can also harass him privately in the chat.
Yeah, you can.
Man,
Even.
just don't accidentally send it to everyone.
I had someone do that to me early on when we started these things. It was quite funny.
Oh yeah, he really did. Crystal
really did.
made a fan. Crystal made a super fan on a webinar, and he would send her messages.
Only incentive to everybody?
No, it was just to me privately. A name that I didn't recognize. I was like, who the heck is this? And then like 3 or 4 days later, I find out it's like one of my closest friends. I'm like,
oh my
what?
gosh, that is so funny.
That's funny.
They're totally harassing me. I was like,
I never
who is this person?
Crystal, I never heard the follow-up. That's so funny.
Oh yeah, the one that was like, I'm dying to try out my new bathing suit.
Yeah,
What?
that's so funny.
Who is this? And then I just was like, I'm not responding to this person anymore. Yeah. Yep. Turns out it was a close friend, and he was like, it was so hilarious to see your facial expressions. I was like, you're bad. You're very bad. Good little humor on Zoom during the coronavirus. It was funny.
All right, I'm about to, it's not up yet, but I'm about to share this to Facebook. So just giving you all a heads up, we will be going live in just a few short minutes or moments.
Because you'll have to run the slides. You post.
Okay, we are now live on Facebook. And if you all are ready, I will let everybody in.
Let's do it.
All right. My cursor's not working. Hi, everyone. Welcome. I see you're all coming in. I'm sharing my screen now. If y'all, this webinar is available for CME credit. And if you are looking for that credit, please change your Zoom name to your LSU email address. And that will make it easier for our program director to find you and give you the credit you earned. Okay. All right. Did you all see that, or should I share it again? I'm going to share this one more time. All right. Yeah, sorry about that. Sometimes it doesn't show all the way. All right. All right, I'm going to stop sharing my screen now. Welcome, everybody. Hold on one moment.
Oh, you know what? I'll bet you I have to.
Okay, so, all right, now we're good. We have everyone's screens turned off. Your microphone and your cameras are turned off for security reasons. So you know that. And like I said, all these webinars are available for CME credit. You can change your name to your LSU email address for that. And now we're going to get started. I'd like to introduce Crystal Oliveira. She's our Chief Development Officer here at the LSU Health Foundation.
Hello, everybody. Thank you for tuning in. The ongoing COVID-19 web series. We are joined today by Dr. Robert Laughlin, Interim Dean for our dental school, along with Assistant Professor Karen Bruggers of our Department of Prosthodontics. And they are going to be sharing the novel protective equipment they developed at the very beginning of the coronavirus, and we're very excited to have both of them with us. Take it away.
Thank you.
Is it Sharon?
Yeah, it's showing.
Okay. Good deal.
So how this all kind of came about is, well, you know, with the coronavirus and the N95 masks and the lack of production and resources that we were be able to isolate and get those masks was a big concern, and making sure that our students and faculty were all protected throughout this process. One of the, we had done some, looking around, and turned out that there was a lot, there's been a lot done with 3D printing. So that was kind of the basis of being able to, where this process started. And, we'll show you some of the iterations as we have moved forward to the pretty much the final product. One of the real needs for our students and our faculty to be able to have that protection is because of the aerosols and that the drills, the dental drills produce. So it's a matter of just keeping keeping the aerosols down and making sure that patients and our faculty and students weren't breathing those aerosolized particles. So it was certainly a collaborative effort between our prosthodontics department and Dr. Bruggers here, our chair of the prosthodontics department, the central lab, as well as oral and maxillofacial surgery. And when we started looking at all these things, we started saying, okay, well, how is it that this N95 mask works? How can we duplicate that and be able to filter these aerosols out and the virus out and protect us? We looked at just many different aspects, from being able to purchase rolls of the filter paper and how we could integrate that into a full face mask. So there was a lot of thought that went on behind the scenes, and we initially, like I said before, started with this 3D printing, which a lot of surgical guides, stereolithic models of the musculoskeletal system have been produced with these. And the other aspect about what we were looking at is also the shields, to be able to do visors or face shields to couple with the N95 masks that we were working on.
So I'll tell you, this is the lab tech team that we worked with. It's a combination of several of the faculty from the Department of Prosthodontics, along with several of the Central Lab and DLT program faculty. We're unique in the country in that we're the only school in the country that have a dental laboratory technology program within a dental school. We also use several of these members who are technicians as faculty members teaching the students and everything. So along with Dr. Jorge Palavicini, Dr. Elika Yu, who are on the faculty, we had Edwin Key, Suleiman, we call Hamdan Suleiman, Julio Zavella, and Paul Wynn, who worked with us all the way through. They pulled Dr. Laughlin and I in quite often as we were going through and thinking of ways we could produce everything. And so what you're seeing here is some of the initial printing things that we were going through. Those are some of the smaller printers that we had, starting to make the forms for the fittings for the face shields is where we started. From that, when this coronavirus started all across the world, people who were involved with 3D printing started. Somebody's got a thing on. So the 3D printing started showing us STL files, which are the files we use with the printers to be able to determine how we make these printers work. And so that's where we started with all this. And you can see some of the early on products. And we tried almost everything that came out on the internet. We started working with, trying to go through and figure out what could we use that would be reproducible, because we knew at this point we were already starting to run low on PPE across the country. And we had to do something if we were going to be able to see patients even at an emergency basis right now. So here you'll see one of the smaller 3D printers we have now. This is a 3D printing the visor frames for the face shields. You can see how we assembled and put them together. We basically produced enough face shields within the School of Dentistry to outfit all of our students and faculty that needed it. The nice thing was that we did have some STL files. We also sort of worked with them to expand them so we could fit our loops underneath, which many of you know in dentistry, we wear our magnifying loops when we work. So right now we had sort of part of this taken care of with the face shields that help protect some of the splatter, and wearing the goggles or the visors that you needed. But along with that, we knew we had to have something for the mouth and nose area, an N95 type mask that we could utilize to help protect us from any airborne particles. This is just showing our elongation of our face shield frame to be able to support loops up underneath it. So we went from that, and I'm going to let Dr. Laughlin talk in a minute because he was instrumental in going from this. We worked from that with an STL file that we found on the open line source for printing a face shield. And so this is one of the first face shields we printed that you could fit an N95 filter into it, an inline N95 filter. It was fine. The only problem was the printing materials that we could use were hard, which meant they could be cleaned with a disinfectant and reused, which was great. The problem with it was they weren't fitted to the face tight enough. So there was an inability to try to get an airtight seal to the face, which was one of our main problems. Plus the material, because it was hard, was also very uncomfortable to wear to the face. Similar to a fitted N95 mask that is not very comfortable once it's fitted, these were the same way. It would work, but it was uncomfortable and it wasn't well fitted, so we weren't getting an airtight fit. At that point, Dr. Laughlin came in and we started working with the lab techs on how could we change this and make it fit better.
And then basically, we really just needed a material that was going to be pliable, but also be able to hold its shape. We had ordered some additional materials that we could use in the 3D printing, but they were actually not thick enough or not thin enough, not rigid enough. And the technology just really wasn't there to be able to provide a 3D printed mask that was truly form-fitting to each individual person. So one of the next steps was, how do we find a material that is going to be not only cost-effective, maintenance is be able to utilize and disinfect these readily, so it's a reusable, that it's easily cleanable, and that the filtration of it could be easily changed out on a day-to-day basis, on a patient-to-patient basis. So those were some of the challenges that we had. And this is just going through some of the iterations of the masks that we've used. This was the original rigid mask. Here was, I think, the start of something really good in that we used a dental mouth guard material that's used for making bleaching trays or the actual mouth guards themselves. for athletics, and taking the sheets and forming it over top of a precast mold. Here's some of the pictures of the 3D printing with the more pliable materials. You can see that you're just not getting a true form because of the thickness and rigidity of the materials. So we moved on and we utilized things that we know. Here, keep it real simple. We used, again, an EDA base material, FDA approved, was already being used for mouth guards in athletes, as well as, bleaching trays, and very, very safe material that, is able to be put up against the mucosa in the oral cavity without having issues. So by taking that and, applying, stepping back and say, okay, well, if it's safe to be placed against the oral mucosa, we could back that in, then it would be, should be safe to be placed against, epithelialized skin. So you can see in the picture, it has multiple colors and patterns that can be done. It is, non-hazardous components. It's latex free. It's easily cleansable. It's hydrophobic. It's used to coming out of, in the mouth with saliva, being able to take it out, having it dry, maintain its shape, and then being able to reuse it after undergoing moisture. And it's easily moldable. So we went forward with a very, very simple design. So the whole mask is composed of really two pieces. One is the actual mask itself, which is, again, a hydrophobic material, has been thoroughly tested, FDA approved for oral mucosa, and it was, again, fabricated over a precast model. And then the second portion of it, here's some additional pictures. We were able to actually have the precast models to be able to have a extra small, small, medium, and large, as to be able to really get a perfect fit once actually fitted, and really be able to provide the protection that everyone needed. Then this is the second component of the mask, which actually inserts into the hole that you saw in the front of the mask. And this provides, this is an inline anesthesia filter. They're utilized every day in anesthesia. It hooks right in to the ventilator lines. Its bacterial filtration efficacy is 99.999%, which would be the equivalent of a N99 filtration. The viral filtration efficacy is greater than 99.99. It's got great flow resistance. Again, these are used, FDA approved, used in anesthesia cases throughout the world on a daily basis. So our whole design was to be able to create something very simple, that was cleansable, that was moldable, that was comfortable, and couple that with an FDA approved inline filtration system. And here's some of the process.
Yeah, so because the material is thermoplastic, and thanks to Dr. Laughlin, we actually have a large our biggest problem up front was, again, trying to make this so that it was cost effective, worked very well, was easy to clean, had all the positives. Well, this is a large thermoplastic suck-down machine is basically what we call it. And we typically in the lab can only do one at a time. These are the different molds that the lab's made of different sizes. So we know what size of mask we're making. And we can make, I believe when we worked with the lab, we can make up to about 15 of these at a shot every time we do it. So production-wise, we can go very quickly and make the initial part of the mask, which is what we've done here on this machine. Then after we do that, the masks are cut apart. Again, we've done them designed like this. They're cut apart. And then there's a process whereby, because it's thermoplastic, we use, again, things that are normal for us in dentistry, a hot water bath that is heated. And then basically the mask can be molded individually per everybody's face. So we fit it to the size we need, then we use the hot water and we custom mold the mask to that. The filter portion of it stays the same throughout the mask procedure. So the good part about that is we can change out the filters when necessary, but also it doesn't mean you need to make a new mask. And because we can wipe down these masks with the same wipes we use every day to kill viruses and bacteria, it makes it very easy to maintain these masks long term.
Then the other issue was now you have filtration. The filters were becoming harder and harder to get as more and more, companies were across the world were grabbing them up. So we are able now to actually reuse our filters after going through a UVC cleansing sterilization process. So now our students are able to take a mask and take the actual filter and bring it down to our centralized sterilization for the filters, have their filter run overnight, and then they come back in the morning and they have their filters ready to go to see the next patient. What we're telling our students is whenever the filter becomes more difficult or creates some resistance to breathing, at that time we're ready to change out the filter altogether, and we'll issue a new housed filter. But this is the designs. Again, it's a custom fit to each individual. The whole process, I want to say, is from start to finish, maybe 15 minutes. Yeah. And that's from scratch, from the actual mold to the thermoplastic material, all the way to fitted with custom straps and the insertion of the filter. Pretty quick process.
I think the other thing that we found with this is Dr. Laughlin did have the mask tested down at LCMC to make sure that we had the seal that we were hoping we would have. We've also found that it's very easy to test your seal with this compared to an N95 mask. And I think the final thing that we found with this is that it's also easier to breathe out of this, even though it's an N99 filter, than it is with a fitted N95 filter, which has been a real positive.
One of the, full disclosure here, one of the complaints that we've gotten back from our faculty is that it's a little bit difficult to talk through,
right,
and have the student listen, understand fully. But I think that was the initial complaint, and I think it's getting better and better as people continue to use it. I think they're starting to understand a little bit more on the conversations. Yeah. Here's just a, if I can bring this in, here's just a live model of actually the mask itself. Slips on very easily, seals up very nice. And I've had it on when we first started doing this. I put it on. I would sit in the office for 4 hours at a time, typing or working and didn't have any issues with it. We now have them in LCMC, as well as all of the students and faculty here at the
Right.
dental school have all been fitted individually.
Yeah.
And they're being used with all of our aerosolized procedures.
Yeah. Okay. Questions?
Oh, there you go. Thank you, y'all. Thank you so much. I was really interested to see what these were going to look like, because I haven't seen a recent photo. So I'm so glad you have one. So we do have some questions coming in. And one is, so how many people are wearing these? Like, how many are circulating around campus right now or around New Orleans?
Well, they're basically right now at the dental school or with the oral surgery residents at LCMC, right?
Yes.
So basically,
And a few
few
people in
people within,
LCMC's
Right.
in
At UMC.
ICU and ER.
right.
Oh, wow. Okay.
Yeah.
So not just for people in the dental field, they're being used.
No.
That's
No.
great.
We're in the process of going through some legal things to be able to expand it out from that, but yeah.
Are you all considering making this your real career and you're going to branch off into manufacturing?
Not me.
Not me.
Not at all.
All right. We have a question. How much does a 3D printer cost? And this is funny. And sign language course for down the line for communication.
And sign language course, yeah. Well, we just told everybody to talk louder. We have a couple of very quiet students, but we told them they're going to have to enunciate and talk louder. A 3D printer, actually, the 3D printer, we're not using to make these masks anymore, but a 3D printer, you can get a good, decent 3D printer now for about $500. It is not going to do some of the 3D printing like we use within the dental school, but it can make some basic things with 3D printers. So they're fairly inexpensive for a low-level 3D printer now.
Wow. That seems so far off, just like a decade ago, right? That
Yeah.
sounded like the
Well,
greatest idea ever.
they've dropped down tremendously in the past about 3 or 4 years. So, and they're getting more and more expanded. Now, of course, the more intricate and the higher level you go with the 3D printing, the more expensive the printing machine is. So we now have, again, thanks to Dr. Laughlin, we have a Stratasys printer, which is one of the highest level printers that you can get, that we are very hopefully soon going to be starting to really utilize with medicine and dentistry within the system.
And so about how much is each unit costing to create?
We have gone through, and what we have figured out is between materials and labor, you're probably looking at, and this is one of the things we've had to come up with, because if we do start sending it out and doing things, of course, we've got to be able to cover our costs with everything. You're probably looking at about $35 or $40 per mask by the time you've done that.
Okay.
But if you put that into the context of being able to wipe it down and reuse it for long periods of time, it ends up being much less expensive compared to disposable masks.
Yeah, definitely. I mean, that's almost as much as people are paying for the designer masks we're seeing around town.
Right, right.
We have a question. Oops. Are you doing, sorry. Are you doing qualitative fit testing only with user seal checks, or are you using something like Bitter as well?
I'll let you take that, Dr. Laughlin.
Well,
you get it.
we, yes, we have gone down, taken the mask down and actually fit tested them at UMC, as well as we have just purchased a porta counter, which is a company that creates a machine that actually gives a quantitative number, and that can be compared against a properly fitted N95 mask. So yes, that is, and we're getting ready to actually do a research project to be looking at the use of the mask, both these masks as well as the 3M N95 masks. You know, we'll have the patient properly, or individual properly fitted, and then as they move about and do their dentistry in a controlled setting under mannequins, will then retest at time intervals to see if the actual mask is holding in the same position and it's keeping the same 100% fit that it started with.
Okay. Let's see. So Edwin Key says you have made 700 or more masks.
Very good, Edwin. Thank you. He's the lead technician on this.
Okay. Someone is asking, have you patented this for an income source?
Actually, yes, we have.
Yes, it is patented.
It is patented.
What's the official name that you're calling them?
We haven't gotten there yet.
I don't think we've gotten there.
Tiger mask.
Tiger mask.
Tiger mask.
All right.
We haven't thought about that. We've been more worried about trying to protect people first. First things first.
Right. You got to let us worry about your branding.
Yeah.
There we go.
There you go. There you go.
But we'll start a poll.
Yeah.
There you go.
We'll get some ideas from students. Someone is asking, if people on the medicine side are interested in getting one of these, how might we go about doing that?
We are actually right now in the process of dealing with downtown on how to make that available to them, because we do want to make that available to medicine.
Okay.
So we're working on it, I promise you.
And that's to go to all LSU.
Yes, all
LSU Health Science
Yes.
Center
Yeah.
schools.
Yeah, not
nursing,
just medicine, nursing, PA, PT,
public health, everybody.
OT, yeah.
That's great. All right. Do we have any more questions from our audience? Please feel free to post them there. Anything else y'all want to share? Has it been a fun experience, or is it still a little stressful?
I'd say it's been fun.
It's been fun.
It's trying to solve that problem. And I think we did a very, very nice job, and at a very, with the materials that we were using, very simplistic mask, but highly, highly effective.
Right. It was a good team effort. I mean, it truly showed the collaboration between everybody around here trying to work toward a common goal.
Right. And it showed how creative and outside the box you can be too.
Yeah. And that's one of the things, our dental lab techs were instrumental in helping us go through that. I mean, they worked hours with us every time we'd come up with an idea. They'd work on it. They'd bring us a prototype, and we'd start playing with it. And if you saw all the prototypes we went through, it was pretty amazing.
Yeah. Well, you have a story to market this for sure. When y'all get to that, we'll have a meeting. We can strategize everything. And then we do have a funny comment. Somebody is suggesting, actually someone's asking, does facial hair interfere with the fit?
I personally don't have facial hair, but it hasn't been tested with facial hair. We do have some students that have beards, and they actually are able to get a self-seal on the with the mask.
Right.
We have not taken those students and sent them to get actually officially quantitatively tested. But yes, they are able to create the seal. Just with the custom fitting.
What we don't know is as their hair grows on their face, whether it changes it or not, or whether it has to be refitted. We haven't looked at any of that yet.
And refitting is extremely easy.
Very easy to refit.
Oh, that's great. So somebody did ask, do you have to do a fit test like you do for N95 masks? Do you have to medically qualify the wearers?
Well, yes, I would say the fitting here is truly a customized fit. You're going to get, basically you get a small, medium, or large, or extra small size. That's determined by your facial features. We look at how far you smile because you want to be able to talk and enunciate and smile and do all the things underneath the mask. So we need to make sure that it covers all of those areas. And then the masks are actually heated up into a water bath, the edges of them, and then that's actually applied right to the face, and it will mold customized directly, you know, give you a perfect image of, perfect seal of, you know, each individual's face.
Okay. And then finally, if there are no more oh wait, there might be one more. Dr. Douglas Swift is saying, very interesting and innovative. I'm thinking of the OSHA procedures and testing the fit, at least a qualitative fit test.
Yes, and that's what we'll be initiating with the protocol.
Right.
And then we have a suggestion for the name, LSU Super Sucker Spit Saver.
I think we're going to pass on that one.
Thank you for your contribution.
But that's a great start.
Yeah, there you go.
And will you make a clear version so that it has the advantage of seeing your whole face?
We did make some clear versions. You can make clear versions. Quite honestly, they fog up a little bit on the inside with the breath going through. Most people have not liked the clear ones.
Yeah.
Well, I mean, we can make them. Yes, you can. I don't think it gives you any advantage as far as being able to see for speech or anything like that, though. I'm not sure there's a big advantage with that. Most people have enjoyed the purple and gold, or we've had the black ones and we put on states stickers. So we kind of go
Gold fleur-de-lis.
gold fleur-de-lis. So
Yeah. Yeah, I'm sure it's fun to dress them up.
yeah.
All right, everyone. I'm going to post the URL where you can see the recording of this webinar. It will be just a couple hours. We'll have that up on our website, so you can share this with everyone. You can watch it later. Yeah, and that's at lsufoundation.org/coronavirus. And Crystal?
Well, I just want to say thank you again to both of you for taking your time out of your busy schedules to share this information with us. I know when I first saw the story, you know, I was just so proud of the dental school. I always have been thrilled to work with you all, and your creativity, your innovation, and just the ability to just roll up your sleeves and get things done has always amazed me. And I feel so honored to work alongside each of you, and thank you for your contributions to dentistry and beyond, clearly. And what an amazing thing that's come out, and I'm excited for it to be available to everyone at LSU. And thank you again.
Thank you all.
Thank you.
Thanks, everybody.